Hi friends, let's continue our education on the topic of digestive tract, and today we are going to talk again about small intestine. Lecture 9a is a part 3, and we will talk about problems with absorption. When person has IBS, IBD, celiac disease, or post-bacterial and viral infection, often they will have the following symptoms such as gas, bloating, nausea, sour taste in the mouth, flatulence, abdominal pain, and often acid reflux. This lecture is continuation of this part 1 and then part 2 where I talk about natural treatment. So people presented with the problem of absorption, and the presentation of the malabsorption is a deficiency of different nutrients. And the most common deficiencies in the primary setting is iron, iodine, and B12 deficiency. People come with the complaint, I am tired. Never any of those deficiencies. People come and say, hey, Dr. Wax, I have megaloblastic anemia. No, they always complain about tired, and then you have to go and explore why people have this problem. Vitamin D deficiency, usually presented in adults with weak immune system, where people will come and say, I have this viral infection or different viral infections because my kids come from school, and every month I have some kind of viral infection that will linger for days and sometimes even weeks. Calcium deficiency is even more difficult to express for patients. It's until you do DEXA scan, and it's presented with osteopenia and osteoporosis, unless person falls and then you look at the X-ray and osteoporosis is there. So in the previous lectures, I said that the purpose of the small intestine is break down the food into final small particles with digestive enzymes, and eventually everything will be absorbed through the tissue phase, and this is the surface of the small intestine. Also, in the previous lecture, I said that small intestine is made out of villi and deep crypts, tall villi and deep crypts. Those villi line with the cells that actually will absorb individual nutrients. Here on the right, you see the picture. When person has celiac disease, you can see villi are not tall and crypts are not deep. So you can assume because of the physically, the cells get slashed, the villi get slashed, the number of the cells that line those villi are not there. So the food cannot be absorbed fully. As a result, person will complain about deficiencies, which called absorption deficiencies, which in our bodies will be presented in form of some kind of physical complaint. Often people cannot make a connection between, oh, I have IBS or IBD, and then I have some nutritional deficiency, and here is the clinical symptom like anemia expressed as the tiredness. So what we are going to do in this presentation, I will build the link between food and actually clinical presentation of deficiency. So if the food is not absorbed, you are going to have a clinical symptom. For that, let's go to the blackboard and talk more about that. As always, I already pre-draw for us picture, my favorite picture of the digestive tract. And it is mouth with the teeth, and the food will go here. And then it will go through esophagus, will drop into the stomach, which will produce hydrochloric acid and will help to break down the protein. By the way, saliva in the mouth will have a weak digestive enzymes. That's the place where digestion starts. Then it will arrive here into the small intestine. In the previous lectures, I said that in small intestine, we have other types of digestive enzymes. Also, the liver is here, will produce bile. Bile will drain here into small intestine. We also have in small intestine pancreas that will produce pancreatic enzymes. And then food is broken finally here in the small intestine and will go into the bloodstream. And here is the large intestine. And if there is some food is not digested or not broken down, it will go out of our body. So you put the food here into the mouth. Let's say that food, because food is a complex substance, right? It has some fat. Let's draw fat as a round substances. So here is your fat that comes in form of food here, and it's connected. Pieces of fat get connected, and they come into your mouth. Fat comes from pork, beef, avocado, olive oil, nuts and seeds. And here is your protein, comes in the form of amino acids. They are connected amino acids. So they also go here into the mouth. And let's say these complex sugars, let's draw them as triangles. Also, they connected. This is a piece of sugar. When they get in the mouth, so they start to get broken, and several pieces get broken here. Protein starts to get broken down here into the individual amino acids, here already individual amino acids, and finally, in the small intestine, everything broken into the smallest particles. Let's draw a separate picture. Here is this example of the small intestine. It has villi here, tall villi. Okay, and here is a broken down your individual protein in form of amino acids. They are floating here. This is the piece of sugar already, and this is a piece of fat. So what happened? They will get here through the villi and will get absorbed into the bloodstream. And let's draw the bloodstream. Here is a bloodstream, going to be a bloodstream. Oh, let's draw it. Let's have it red. That's the bloodstream is going to be red, right? So you understand that this is the bloodstream, and they get absorbed through the surface of villi into the bloodstream. Here is your piece of fat. Here is your piece of protein is floating here, and here is your sugar, and some vitamins and minerals are floating here. What happened? Body will start to incorporate that into our cells. And let's give you example. Our cell membrane is built out of fat called lipid bilayer. So here is the lipid bilayer. Let's say this is the cell, okay? And cell has a nucleus, and it has all kinds of items inside in the cells. So lipid bilayer is built out of fat, and this fat is made out of two main components. One so-called good fat, omega-3, and bad fat, omega-6 and 9. This is the fat, this piece of fat, exactly this piece of fat that comes into your mouth. Suppose person has a problem in the small intestine. Let's say the villi, like in celiac disease, they are not that tall. So person does not absorb this fat. What happened to this fat? It gets through the large intestine and get excreted. So when I talk to my patient or clients, I ask, is your stool greasy? Does it mean, does it have fat? So what I'm asking about this fat that end up in the stool, the answer may be, well, I'm not sure 100%, right? Maybe it is. So it's important to look in the bathroom when you go and see, oh, the stool is really greasy or not. So that will be a symptom for me or for you to understand. Then, because this fat get lost here with the stool, it means that it's not ended up here in the bloodstream. The body needs to rebuild cells in our body, because if cells are not there, body is going to die. So body starts to build different fats. Suppose person say, I don't like fish, and then person doesn't absorb omega-3. As a result, body will start to build cell membrane out of the fat that's readily available. Now, suppose person eat pork or chicken. So the ratio of the good fat and the bad fat here, when the cell membrane is built, is not there. As a result, it looks like that, something big, something small, whatever fat is available. Unfortunately, body cannot tolerate the cell membrane that is built that it's not very sound structurally. So as a result, the cell membrane is unstable. Body cannot have unstable cell membrane because unstable cell membrane means that the cell membrane will get broken, contacts of the cell get spilled into the bloodstream. The broken cell physically or clinically translates into diagnosed broken cell. If it's in the brain, it's a stroke. If it's in the cell broken in the heart is not structurally sound. It means heart attack. It's bruises. So body cannot tolerate this unstable cell membrane. So body will start to produce cholesterol. Let's draw cholesterol pink. So it's try to stabilize the cell membrane with cholesterol. So on this example, guys, you can see that in this particular case, person will have elevated cholesterol. Cholesterol or elevated cholesterol is a symptom of something that is not going right in the body. So let's go back into the PowerPoint presentation and let's talk about deficiencies. We need to increase absorption. We need to help body to supply all kinds of nutrients. What do you do for that? And the step number one, you start to eat varieties of the food. And then everything have to be cooked. The temperature actually will help to break the food. Here on this example, you can see it's a stew. So the protein and fat is in the meat. So what you do, you break by cooking, you break down the protein into smallest particles. You help the body to break down. Once when they are here, those fat and the protein in the broth, then it's going to be, the body will have better chance to absorb that in form of liquid. Here you see probably potato, here is the carrots, and the source of vitamins and minerals. So people often will ask me, well, when I eat cooked food, is not that correct that vitamins are almost gone out of there? And you are partially correct. Cooking is kills the vitamins because it's almost life substances. So as a result, what you have to do, you have to substitute vitamins with other liquid vitamins. Here on the picture, you can see, especially on the right, is a back label of the vitamins, and you can see that the liquid vitamins will provide you with vitamin A, vitamin C, vitamin D, all the vitamins that may be not heat stable. As a result, you will provide liquid vitamins. They are easy to absorb for the body, and hopefully you will replenish nutritional deficiency. If you have, guys, any questions, please ask me there in the description. Otherwise, like, subscribe. Bye-bye for now.